My name is Cecilia Fernandes, Pediatric Neurology, Prisma Health. So I was born and raised in Dubai. I'm originally from India, and I did medical school in Nepal, following which I came to the United States to do all the rest of my training, which is pediatrics and pediatric neurology. For the longest, I know I was interested in pediatrics, and I knew that children were really what I wanted to look after throughout medical school. But when I entered pediatrics, I realized that I was drawn towards pediatric neurology. So every time I would see an interesting case of pediatric neurology, I would end up being the first resident to take ownership. And that led me to eventually choosing the field of pediatric neurology. I think children are very interesting because they have a lot of energy. They have this drive to live, this drive to succeed in whatever they are doing. And I see that even when I'm looking after the sickest child, that they're very resilient. And so this makes me want to come to work and makes me want to look after them and give them the best health possible. So right now, I like to look after children with most of the general complaints like seizures, headaches, they might have weakness. And I feel like I don't really have a niche. And I think that's good because I go in feeling very open-minded. I enjoy talking to families and trying to figure out what's going on with a child and then eventually coming to a certain problem. So I don't feel like there's a specific disorder or disease type within neurology that I'm really drawn to. I like the entire length and breadth of it. Some days I feel like I'm drawn to, more critical care management. So I look after patients, inpatient, who have neurological problems. But at the same time, I also enjoy this long-term care of children, which is why I wanted to continue looking after children in outpatient clinic with neurological problems so that I can build this bond with the family. And it helps me use my skills of counseling, talking to them, and long-term care of their child. So I see myself as someone who's patient and kind and compassionate. So I feel like that gets amalgamated in whatever kind of practice I do. So I feel like a lot of my work revolves around counseling patients, revolves around looking after children who have complex disorders, who have developmental disabilities. And I like to look after the children who you can make a difference in long term. And so my style of practice involves most times having those conversations with families, whether it be inpatient or outpatient, about the neurological prognosis of their child, what to expect on day-to-day basis versus what to expect long-term, and help them make better decisions for their child, because I see myself as someone who is a support for them, more so than the person who's driving the situation, because I always think the main people that are invested in that child's care are first the parents, and then we come in as that support system to help them move along with everyone having that best interest of the child, to be successful in whatever abilities they have, to live the most fruitful life that they can have. The first thing I noticed when I came here to Prisma Health was that people were very kind to me, were all invested in wanting to serve and wanted the best for me. So they always were inquiring about what was it that I would like to see myself do here. And that spoke for how the care is here, the values. And I think those values resonate with my own personal values of providing service to others with kindness and love. And that's really what brought me to Prisma Health. And I think Prisma Health gives you all the opportunities, at the same time has all those facilities to enable the physician to be able to provide the best care. And I think that's what drew me here and made me want to begin my career and take things along. My interests outside of healthcare revolve mostly around one spiritual being. So I am a meditation teacher and conductor, and this is not just limited to one particular belief. It is all inclusive, and so I help people them understand themselves better, work with a lot of volunteering organizations to help people where they might need, specifically in the community. So there's different volunteering opportunities like food drives and things like that. And I've been spending a lot of time now doing meditation programs online to help individuals of different age basically deal with stress and other life related problems. So I think that's particularly something I spend a lot of my time doing outside of medicine. I feel like when patients come to me, the only advice I would think about is be completely open, share everything you can, because I am only here to listen, to receive, and then to make sense of it, and to my best ability, and help you understand the situation better, whether it be a medical problem. And sometimes I know people might come just for that support, in terms of maybe getting a medication refill, or maybe it might be a long-standing chronic illness and they're trying to just receive support for that. And I feel like that's primarily my advice to them, that with any physician, be as open as you can, share all the information that you can so that we can best help you. And if we couldn't, at least we can find the resources that can help you best in the best manner possible.